irrigation procedure. Assessment. First is identify patient using two identifiers according to agency policy. Good morning, sir. My name is Crystal. I will be your nurse for today. But before we proceed, I would like to know some details. What is your name, sir?
Ramos.
Yes. Next is assess patient's level of pain. How do you feel right now? Do you have any pain? From the scale of 0 as the lowest in pain scale and 10 as the highest.
5.
Okay. Third is review medical record for healthcare providers' prescription for irrigation of open wound and type of solution. I will check your medical records for irrigating prescription solution. Review medical records for signs and symptoms related to patient's open wound. Sir, do you feel any untoward signs and symptoms concerning your wounds?
No.
Okay. I will assess your wound site and please tell me if you feel any pain during the assessment. And for the planning, explain procedure of wound irrigation and cleaning, how you will prepare patient. Wound irrigation is a non-invasive procedure in which a steady flow of solution is used to achieve wound hydration, remove debris, dead cells, pathogens, and excess blood or other exudates such as pus in an open wound and assist with a better visual examination. Second is administer prescribed analgesic 30 to 60 minutes before starting wound irrigation procedure. 30 minutes to 1 hour, sir, before we start irrigating the wound. Administering prescribed analgesic could help to control the pain level and could help you move easily. Next is position the patient to access wound for easy irrigation. And next, sir, I will place you on your comfortable position during irrigation. For the implementation, first is perform hand hygiene. It reduces transmission of microorganisms. Second is form cuff on waterproof bag and place it near the bed. Cuffing helps to maintain large openings, thereby permitting placement of contaminated dressing without touching refuse bag itself. Third is close room door or bed curtains. Fourth is apply gown, mask, goggles if needed. Protects nurse from splashes or sprays of blood and body fluids. Next is apply clean gloves and remove soiled dressing and discard waterproof bag, discard gloves and perform hand hygiene. Next is prepare equipment, open sterile supplies. For the seventh is put on clean or sterile gloves. Next is to irrigate wound with wide opening. Next is obtain cultures if ordered after cleaning with non-bacteriostatic saline. Types of wound culture obtained depends on resources availability in facility. The three most common types of wound specimens are tissue biopsy, needle aspiration wound fluid, and swab technique. Next is assess type of tissue in wound bed and peri-wound skin. Identifies wound healing progress and determines if wound has increased in size. Next is dry wound edges with gauze. Apply appropriate dressing. Maintains protective barrier and healing environment for wound. Next is remove gloves if worn, mask, goggles, and gown. Prevents transfer of microorganisms. Next is dispose of equipment and soiled supplies, perform hand hygiene. And the last is help patient to comfortable position. And lastly, for the evaluation, inspect dressing periodically. Determines patient's response to wound irrigation and need to modify plan of care. Second, determine patient's level of pain. Patient's pain should not increase as a result of wound irrigation. And last, observe for presence of retained irrigant. Retained irrigant is medium for bacterial growth and subsequent infection.